Hello everyone. We are going to talk about cannabis and family. How to talk about it. How do we talk about cannabis with our family? Hi, I'm Ezra cannabis consultant. EzraHelps.com is where you can find me. And feel free to ask questions in my live post today. Hope everyone had a great Christmas. Merry Christmas, Happy New Year, Happy Holidays to everybody. I wanted to talk about this because holidays is a time where our families get together and we have such a strong cultural perception around cannabis. Some people are completely open about it and use it casually and it's no big deal. Some people are terrified of cannabis. And so I like to stay in the middle ground where we're making sure that everyone is informed about cannabis, that we're using it medicinally, and that people understand on the full spectrum. How should we use it healthily if we're regular users? And how do we convince some people to try cannabis where they might be able to benefit from it and they're being harmed or having difficulties with conventional treatments? So I imagine that if you're somebody who's interested in cannabis or using cannabis or curious about cannabis, but don't know how to share it with your family, the very first place I start is with the science. And science is, I know science can be a loaded term in our culture and in our politics, but as far as cannabis is concerned, science is a great place to start. Because science scientists are not doctors necessarily. They're not saying, all right, how does it work on patients? Scientists are just interested in figuring out why stuff works, where stuff comes from, and what we might do if we're going to make a medicine out of a plant, for example, that we find in the rainforest. And so scientists need to research it. So the great place to start, if you're going to talk about cannabis, is, I might say, wow, it's amazing how many states have legalized medical marijuana, and what do you think that's all about? And that's in the news right now, and we hear about it a lot. And if you're informed, you might start off with the ECS. This is the endocannabinoid system. So the ECS, I predict that in 50 years, 20 years, 100 years, I'm not sure how long, but I predict that doctors will consider, and the health field will consider, the endocannabinoid system to be as revolutionary a treatment target as when we think about something like germs. I mean, for years, germs were thought to be a fantasy of people. They didn't know why they talked about germs. Nobody kept hospitals clean. They didn't wash their hands before surgery, and now they do. And the ECS is a feedback system in the body that responds to cannabinoids from the plant. But the plant has nothing to do with it. The ECS actually was created in organisms hundreds of millions of years before the plant was ever evolved and created its own cannabinoids that fit into our endocannabinoid system. And our endocannabinoid system is a feedback system that cells use to communicate and change behavior that is the largest feedback system in the body. So it's in every organ. It's in the bones, it's in blood, it's in our connective tissue. So if we're looking at cannabis from a scientific perspective, it's important to just sort of set the plant aside. The plant is so loaded, people have all of these stereotypes and perceptions around it, and just say, all right, let's focus on how our body receives cannabis. What's happening? This is what the very first researchers did in the 60s, 70s, and 80s. They said, all right, well, nobody's synthesized the chemicals in cannabis. Let's figure out what it does. And they uncovered this incredibly vast and important feedback system in the body. So when you're going to, if you're going to convince grandpa or grandma to use cannabis or study cannabis or at least be open to it as a medicine, it's very easy to go on the internet, type in the word cannabinoid, type in any disease. So for example, a really good one is Alzheimer's. I like Alzheimer's disease as a topic of exploration because there has been many studies on Alzheimer's. It's a very current disease. A lot of people are getting diagnosed with it. And cannabis has been shown to help some of the symptoms. And there's recommendations that cannabis should go into more complex clinical trials in order to help Alzheimer's patients. So I have a study right here. This is from Frontiers in Pharmacology. So this is a scientific study looking at all of the data on cannabinoids and Alzheimer's. This is from a study called Cannabinoids for Treatment of Alzheimer's Disease. So there you have it, right there. Cannabinoids for treatment of Alzheimer's disease. Certainly someone should perk their ears if they're thinking about, oh wow, okay, so here's a real scientific study. These are cannabinoids. These are actually the chemicals that we produce naturally in our body and that are mimicked by the plant. So the plant produces cannabinoids that are almost identical to what we produce. Here's the last sentence of their study. It says, in conclusion, in light of the limited side effects exhibited by these compounds, by the cannabinoids, progress toward a clinical trial to test the capacity of cannabinoids to curb this neurodegenerative disease seems to be fully justified. So here are scientists just looking at what cannabinoids do in the system, and they're trying to understand it, and they're saying this is a potential medicine. So that's a great study to start with. And you can do that for pain. You can do that for nausea. You can do that for sleep. And you just type it in. You type in cannabinoid, you type in scholarly, because we're looking for just the scientific articles, and then you type in the ailment you're dealing with. So that's a great way to just introduce it and talk about it, talk about it from a scientific perspective. Should be objective. And then what is the goal? What is the goal if we're talking about medical marijuana and talking about cannabis in general? Yes, there's the abusive side, but I'm just going to focus on that. I will, and in just a few minutes, we'll talk about the high, what it means to be high, and what it means to if we abuse this drug, which is possible. But my goal, if we're talking about medical marijuana, is can we reduce symptoms? Can we decrease unwanted medication, and can we increase quality of life? So that should be a goal of any medicinal practice. And when we think about that, the number of people in hospice, people who have chronic pain, people who have sleep issues, issues associated with cancer care like nausea, anxiety, these are all words you can look up in conjunction with cannabinoids and scholarly and find scientific data on the effects of cannabinoids on these. So when it's used properly, cannabis is just a boring medicine. Most medicines originated from discovering their uses in plants, and we began to synthesize them and make them into pills. The powerful thing about cannabis is that it's a plant. It's powerful just in its raw form. So start with the science. Now, let me just check to see if anybody's tuned in here and have any questions. Just let me know if you do. But let's talk about the high a little bit. This is something that a lot of people worry about. Okay, you know, they say it's a medicine, but I don't want to get high off of cannabis. And this is a real concern. A very small amount of THC can enter the body and make you feel so uncomfortable that it's a very scary feeling. If you're used to THC in your system, if you're used to the active chemical in cannabis affecting you and getting you high, then it's not such a big deal. You're used to it. You develop a tolerance for it. But acknowledging that the high is a real and pronounced feeling for many people is important. It's my opinion that it's because it gets us so high in a very specific way that over the centuries we've been for and against cannabis many times, because some people feel the effects of it and it's really scary to them, and they say, well, I'm the mayor of this town and we're going to make this illegal because I don't want to feel this again. So that it's important to empathize and acknowledge that some people do not have a positive experience. But if we compare it, if we ask sitting around the table and we say to ourselves, all right, well, maybe I've never felt high, or maybe I say the high of cannabis isn't so bad, and so we're in a debate with people around the table, we might ask ourselves to compare it with other things. So Alcohol, opiates, benzodiazepines like Valium, nicotine, and caffeine all can be considered substances that get us high or alter us. They're psychosomatic. They alter our state of being. And alcohol can be an extremely uncomfortable feeling if you've never been drunk before. But moderate use of alcohol is pretty reasonable. It's the same for cannabis. You can take a moderate amount of cannabis and feel completely safe and normal and cognitively aware of your surroundings and your situation. And so it's a very similar comparison. It's just that alcohol is not toxic. Alcohol is toxic to the system. Cannabis is not toxic to the system. So this is why I'm on December 26th having this talk about how do you talk to your family, because we do want substances in our body that are less toxic, that are less dangerous. Same with opiates. Many people get high from opiates. So being terrified of the high of cannabis, although it's real, there are plenty of other legal drugs that get us high. And in fact, opiates get us high and the body becomes addicted to that high, becomes physically dependent upon it, and becomes extremely difficult to get off these drugs. It's the same with benzodiazepines like Valium. So things for anxiety and pain. Cannabis is a viable alternative. If you're in a state where there's medical marijuana, it's certainly something to engage in conservatively in case you can get benefits from that and reduce the potential harm of benzodiazepines or opiates. And then nicotine, that's cigarette smoking. We're all pretty much engaged with the reality of cigarettes. They're very dangerous. And nicotine, if you've never smoked a cigarette before and you smoke one, you will get very high. You will feel the nicotine coursing through your body. It's very strong. Caffeine's the same way. If you've never had caffeine and you take a double espresso, you will be so revved up and you may even be shaking. That can feel similar to the high of cannabis. So they're not all exactly the same. They definitely feel different, but the high of cannabis isn't some greater, more pronounced, more scary feeling than the other drugs that are common and available. The second thing I would talk about, if we're going to talk to our family about cannabis or our loved ones, is that we have to understand that there's a difference between THC and CBD. THC is what gets us high. CBD is this subtle, softer molecule in the plant that still delivers so many of the great benefits of cannabis medicinally. So if you want to talk to your family and they're unconvinced about cannabis, maybe they don't believe that it's a medicine, maybe they're worried about it, typing in the word cannabidiol, so cannabidiol is CBD, and then an ailment, so whatever your ailment, if it's pain, you can type in cannabidiol, pain, scholarly. We always want that scholarly article because we are looking for only the studies that just are presented by scientists and what they're finding in laboratories based on what these plant compounds do. And you'll find that CBD and pain or nausea or anxiety, these are studies that have been done. They've tested it on animals, they've tested it on humans. They do a lot of testing outside of the country, and they'll find that these are effective approaches to ailments that humans and pets experience. I recently just had an amazing success story with a pet delivering CBD for a pet who was going to be put down due to severe arthritis. And that pet responded really well. It was a dog. Responded really well and was able to walk and eat again and regain a lot of its quality of life, and the pet owners are happy with that. So these are, it's just another medicine is really the ultimate goal of that. But here's the final thing that I think is really important if we're talking about cannabis with our family members, with people who may be wary of it or may have had negative experiences with it, and that is how users, people who use cannabis on a regular basis, how they approach it. So if you use cannabis on a regular basis and you're going home for the holidays and you really want to okay, I gotta tell Dad that I use cannabis, or man, it really helps me sleep, and I was able to go off all my sleep meds, but my dad will be terrified if I tell him that I use cannabis. Then you really do have to dig deep as a user and ask yourself, to what extent is my cannabis medicine, and to what extent am I using it recreationally? And if you're using it recreationally, if you're just using it because it's fun to kind of escape at the end of the day and feel high and get a little artificial joy, as I call it, in your system, then you have to make sure that you're not abusing it, that you are being safe with it, that you're moving on with your life. I do see clients who, in my practice as a cannabis consultant, who have anxiety and use cannabis, and I see a medicated loop. This is when people have anxiety, so they smoke more cannabis, it relaxes them for a little bit, the anxiety comes back even stronger, and so they take more cannabis into the system, and then they're kind of a nervous wreck, to be honest, and this is not healthy cannabis use. So if you're a user, you're talking with it with your family members, you want to make sure you can answer these questions. Do I use it healthily? Do I take breaks from it? Do I use enough CBD when I'm taking in cannabis? And do I use it appropriately in terms of using oils when appropriate and taking them orally versus smoking versus vaping? You can find a lot of other topics that I talk about on EzraHelps.com that explore some of these questions. So if we're healthy about our own use and we are aware of the science, then we can much more easily bring these conversations to the dinner table and to people who might need them. If you have a relative, especially an elderly relative who has Alzheimer's, who is experiencing the chronic pain or nausea from too many medications, or is depressed in a terminal disease, that artificial joy can be really profound for them. So I think it's important to be able to bring the topic of cannabis use to patients, to people who wouldn't otherwise be able to explore it or wouldn't know how to explore it, because you can bring quality of life to them where some of the medications they're on have failed. So I hope everyone had a good holiday. If you're out there and you're curious about how to talk about it with your family, or you have a family member who wants to know about cannabis, then reach out to me. You can find me at EzraHelps.com. You can ask questions under my feed here, or this video as it gets posted. You can join my Ezra Helps Facebook group. And thank you all for viewing, and have a happy new year, and we'll see you. I may skip next week, but then we will keep up our lectures going forward. All right, take care, everybody.